Hi everyone, I'm Andrea and welcome back to Conversations We Need to Have, the sex and relationship podcast where we encourage you to be bonobos, not chimpanzees, be lovers, not fighters. Today we're diving into a topic that's sensitive for many people, but one that definitely needs more open conversation. Premature ejaculation, or PE. What is premature ejaculation? So, what exactly is considered premature? Premature ejaculation is when ejaculation happens sooner than you or your partner would like during a sexual experience. That could mean ejaculating before penetration even happens or within about 2 to 3 minutes after penetration begins. Now, you might be wondering, if that's considered premature, what's normal? On average, ejaculation during penetration tends to occur around 5.5 minutes in. But honestly, there's no universal standard for how long sex should last. It's really about what feels right and satisfying for both partners. For it to be considered a medical issue, the symptoms usually need to be lasting at least 6 months and causing distress for the individual or the couple. How common is it? Premature ejaculation is actually the most common sexual dysfunction for men. Research shows that around 30% of men aged 18 to 59 experience it, and some studies suggest it might be higher, around 75%. Interesting, about 30% of men with PE also report having erectile dysfunction, which means ejaculation happens early even when a full erection isn't achieved. Sadly, shame and embarrassment often stops people from seeking help, but that's exactly why we're having this conversation today. If this is something you're experiencing, you're definitely not alone and support is available. Why getting support matters? Premature ejaculation can lead to frustration, sadness, and relationship strain, not just for one person, but for both partners. Sometimes it goes away on its own over time, especially if it links to stress or temporary emotional issues. But in other cases, it can persist, and professional help can make a huge difference. Psychological factors. There are a few psychological factors that can contribute to premature ejaculation. These might include depression, anxiety, stress, guilt or shame around sex, unrealistic expectations, lack of confidence, past sexual repression, and relationship problems. Addressing emotional well-being through therapy, stress management, or open communication with your partner can often lead to big improvements. And as always, I recommend speaking with a doctor or a psychotherapist for guidance tailored for yourselves. Physical causes. PE isn't always just psychological. There can be physiological causes such as prostate problems, low serotonin levels, hormone imbalances, erectile dysfunction, genetics, alcohol or substance abuse, diabetes, or poor sleep habits. So, if this is an ongoing issue, it's worth checking in with your GP to rule out any underlying health conditions. At-home techniques. There are also some well-known techniques that can help with control and awareness during sex. The squeeze method. Stimulate the penis until you're close to climax. Then apply firm pressure near the head until the urge to ejaculate fades. This helps you to learn to recognize and control those sensations. The stop-start method. Again, stimulate the penis, and then just before climax, you or your partner stops until the urge to climax subsides. Repeat this a few times before allowing ejaculation on the final round. Practice this regularly can help train your body and mind to delay orgasm more effectively. Medical options. For those exploring medical options, there are a few worth discussing with your doctor. Certain antidepressants like sertraline or tramadol can delay orgasms as a side effect. Numbing creams, sprays, or wipes can reduce sensitivity. Just follow the instructions carefully and wash them off before sex to avoid numbing your partner. Climax control condoms that can include mild numbing agents can also be an easy option. Finally, the most important thing to remember is you're not broken and you're not alone. Premature ejaculation is incredibly common, and with the right support, techniques, or treatment, it can be managed effectively. If this resonates with you, please do reach out to your healthcare provider, therapist, or even start conversation with your partner, because that's where healing begins. Thank you for listening and have a great day. And remember, be a bonobo, not a chimpanzee. Be a lover, not a fighter. Take care of yourself and keep having the conversations we need to have. And as always, if you enjoy what you're hearing, please rate, like, and subscribe. It really helps these conversations reach the people who need them most.